And welcome back. At least 1 in 5 adults in the U.S. is living with mental illness right now. That's why managing your mental health is just as important as regular checkups for the rest of your body. Well, Chris Nelson with UofL Health is joining us to talk about it. Chris, thanks so much for coming in. We appreciate it.
Thanks for having me, Connie. I appreciate it.
So let's talk about mental health and how it relates to your whole well-being overall. How important is it?
Exactly. And you know, people hear the term, mind, body, and spirit. All these things are important and they're all interconnected. And so stress can be, stress and other things caused from, mental health issues can be a really negative determinant of your health. And so, treating your mental health is going to affect your physical health and vice versa. So
let's talk about 988 and how important it is for someone who's going through something. Talk about what can be utilized on the number.
Sure, it's such a great resource that we have these days over the past couple of years. Just like you can call 911 when there's a emergency, for obvious reasons. 988, you can call it anytime. Any person can call, text. There's a chat online option. And at any time, and talk to a trained clinician that can help them through any kind of mental health situation, get them resources, talk them through a crisis, all those kinds of things.
It's really important for every family to know that's all they have to do.
Absolutely, it's that simple, yeah.
What a great resource it is. Talk about the stigma around mental health. I mean, it seems like even in the last 20 years, it's gotten so much better. So many more people are talking about it, from, well-known actors to people, other people in public life, just kind of bringing it to the forefront.
Absolutely, yeah. I think, mental health professionals have some thanks for that. And I think, honestly, young people, the younger generations we have them to thank for that too, because they're talking about it, right?
Yeah.
So there's a lot of that conversation about, anxiety or depression. And so once you are talking about it and you can put a name to it, then you can address it, And so I think that's, it's a great thing that conversation is happening.
Yeah, I think it's important that you were mentioning young people, because so many people and their families are wondering what they can do. There are a lot of resources out there, aren't there? And especially at UofL Health.
Absolutely, yeah. And so anybody in a mental health crisis, UofL Health and Peace Hospital, we offer 24/7 level of care assessments where we can free of charge, and so we can take care of whatever needs they have and get them connected with resources. And 988 is another good resource too, where they can get you connected with a therapist or psychiatrist or whatever's needed, and get you referred to those services.
Perfect. Thank you so much for coming in.
Thanks
Such
for
an
having me,
important message that you're bringing today.
I appreciate it.
We appreciate it. And don't forget, if you or someone you know needs help, it's available. You can call the National Suicide Hotline. That number is 988, as you heard. You can get all kinds of help there. The hotline is open 24/7.